So let's get going. Thanks everyone for coming back for week 3. This is our last time together, and I've really enjoyed our conversation so far. So I'm looking forward to spending the next 50 minutes together. If you haven't been to the other sessions or you've just been watching videos, or I don't think the videos have been shared yet, but they will be shared at the end of this, along with some more resources. I'm Rachel. I'm a senior research scientist at the Center for Informed Public, which is based out of the University of Washington. And I'm joined by my colleague Maddie as well, who is a postdoctoral fellow here at the center. And we both work on, well, Maddie, who's a social psychologist, I'm a communication and journalism scholar, and we work on information seeking and trust in information and assessments of credibility and all things like that. And a lot of our work kind of touches upon the health space, which we've been obviously talking about for the past few weeks together. We'll drop this link in the chat as we have the past few weeks. This is our Padlet link, so we'll have an opportunity in our breakout rooms later to kind of share back, and we can either use the chat for that or this Padlet link, so we'll give it to you so you have it ready to go. So this is our 3rd week together. These are our objectives for our time over the next hour. We're focusing this week on how do we intervene in health misinformation, and thinking about some of the interventions that are currently in place and, you know, somewhat successful. Obviously, we're all here, so we know that they're not totally successful, and we're all looking to kind of design interventions that work best for our context, our community, our professional situation, and so that's what we'll be focusing on today. So hopefully by the end of our time, we'll have explored some of the successful routes to empowering ourselves and others in our community to engage in successful health information seeking. Success is obviously a very broad term and up to interpretation depending on what our goals and objectives are, and we'll talk about how we think about those too. We'll talk about identifying resources that currently exist and the ones that we actually need in order to build community-based interventions, so things that are tailored specifically to the community context that we live and work in. And we'll have some time to think through designing a potential intervention as well, and doing some creative work about how we could intervene in health misinformation. So I shared this graphic last week, and we kind of touched upon it at the end of our time together, but we'll talk about it a little bit more before we think about what's best for us to design. And we talked about as well, like first deciding if you want to intervene in health misinformation. It's not always a given depending on the context. Sometimes it's just not appropriate in the conversation that you're having. If you think someone shared misinformation, but you don't want to kind of give it too much oxygen, you might want to move on. But there are times, and many times, where it's sort of such an active part of what you're doing day to day that you feel like you have to intervene, either through the creation of resources or just in the moment by talking to that person. So once you've figured out that you want to intervene, the big question is sort of how, and that's what we'll be talking about today. And we talked about last week this sort of information seeking process and where we might have the most agency to intervene or assist someone, and considering what resources we have in order to be able to do that. So we went through these different stages of information spread and identified where some common interventions happen. And some interventions may be proactive. You might work to create, you know, authoritative resources such as fact-checking posts or education materials that tailor information literacy skills to your exact context. Or some might be more reactive, such as engaging in motivational interviewing to try and address misinformation that's shared in the moment. So we're going to work in small groups to envision some interventions that might work for our own professional context. But before we do, I'm going to share some examples that can help kind of frame up what you think would be most useful. So let's have a look at some examples then. I'm actually going to share this link in the chat because I find this to be a really useful one. Let's see if I can find the chat. Oh, here it is. This is an example coming from the resource that I just shared in the chat. That is a motivational interviewing frameworks. And the ones that are on the screen here are adapted to deal specifically with vaccine hesitancy, and so initiate respectful conversations around vaccine misinformation. And there's 2 strategies that you can see on the screen here that kind of help guide a conversation that someone might be having with someone who is expressing vaccine hesitancy or is brought up something that you know isn't true or you suspect isn't true about vaccines. And there's some specific ideas. I really like that kind of OARS framework on the top left there, around kind of summarizing to confirm your understanding, to make sure that you're on the same page when you're talking with someone who's sharing this misinformation. It also helps someone feel kind of heard and respected in that moment. And that second approach on the at the bottom there, it provides this sort of sandwich approach we often use when we're thinking about misinformation, like this truth sandwich. You start with the truth, you address what the kind of the lie or the misinformation is, and then you reiterate the truth. This is a similar sort of sandwich where you kind of ask people what they already know, elicit some of that knowledge. If they share misinformation, you ask permission to kind of engage with that piece of misinformation and offer up something else. And then you sandwich that with, again, asking them their opinions, so you can get a kind of finger on the pulse of what their reactions are. And we have quite a good sense from research that these motivational interviewing frameworks have a pretty good efficacy, particularly within one-on-one conversations, particularly within the health setting when we think about kind of patient practitioner contexts. And it might also be, useful within a workplace setting. And it might be something that you think about designing for your own organizations to kind of give people the resources and the confidence to engage in what can be difficult conversations in respectful ways. It's just this, you have a sense of confidence that you can enter a conversation that is going to be uncomfortable by having a framework for going into that conversation. So this is just one example of an intervention that might be useful. Other ones that you might want to engage in, because so much of our information seeking, we talked about this in our first session together, happens in these online spaces, particularly on social media. Intervening might actually require you to engage in some social media content creation yourself, which I know is not everyone's cup of tea, but I think if you work for organizations that have trust in your community, you can be a very authoritative voice. And so kind of leveraging that authority and that credibility that you've built up to create these kinds of resources can be beneficial, not just for your organization, but for others to point to as well. We see this, we're seeing a lot of this on TikTok. Those examples that you see on the screen are examples from kind of people who are fairly well respected and well followed influencers at this point, but they're actually predominantly medical practitioners who've decided to create these accounts to engage specifically in fact checking and debunking and take on some of that pernicious misinformation that they're seeing on their social media. And so they're, doing what the misinformation makers are doing, but on a kind of good side, and creating this content, engaging directly with audiences. And it can be, a bit time consuming, I think, especially if you take it on as an individual. But if you work in an organization that has some resources and experience in creating content, then it can be a really effective medium for not only providing that authoritative content, but helping to sort of build credibility in a space that is often overtaken by people who don't have the professional credibility that a lot of you on this call have. So you really just have to think about kind of what's your organization's resources, what are your kind of communication strategies, and if it's appropriate then for your organization's goals and context to do the social media route. On the other side, you'll see that there's a practical playbook for addressing health misinformation that was produced by Johns Hopkins. So if you don't want to be the one that's producing the content, you might be the people who produce the guide for producing the content. And this has been very useful. I recently did some work with some veterinarians who are very concerned about vaccine hesitancy that has transferred, from the COVID context to now people not vaccinating their pets, and it leading to not only diseases that impact their pets, but diseases that could then also impact humans later on down the road. And one of the things that they're really hoping to do is to produce a kind of similar playbook for veterinarians to start engaging with some of that hesitancy and misinformation that they're seeing in their practices. So there's the direct route, creating content yourself, and there's the kind of indirect route where you're creating a guide to help other people do that direct work. Another thing that we thought a lot about in last week, actually both weeks, is just thinking about informational literacy. How do we build up our own informational literacy skills and those around us? And so these kinds of interventions might be more education and training based. So we have two on the screen here that are common sort of informational literacy skills or frameworks that we use in our education-based efforts. Particularly at the CIP, we use these with younger people, but they're applicable for all of us. And actually we found a lot of use in older populations as well, who may be facing the kind of dual issue of this influx of misinformation, but also navigating the kind of technical side of being online. And so some of these frameworks can be very useful for those types of populations as well. Lateral reading, which is the one that you'll see on the left, the News Literacy Project actually has some really great resources that kind of teach lateral reading skills. And that just essentially means that you'll see something on your social media feeds or read a news article that's been shared to you, and you'll take the time to sort of open up a new tab on your browser and find other information, engage laterally, and find things that either kind of confirm or deny what you've just seen, allow you to kind of press into that source credibility side of things, and just search more deeply about what you've just engaged with, which is a simple skill, but often overlooked, especially as we talked about in week 1, just because we consume information so quickly. We're scrolling, we're not necessarily looking for the things, they find us. And so sometimes a simple reminder of those lateral reading skills can be highly beneficial. On the right, we have the SIFT framework that was developed by Mike Caulfield, who used to be a fellow here at the Center for Informed Public. And that's just a sort of simple acronym to do this sort of lateral reading that we're asking people to do. So stop, investigate the source, find better coverage, and then trace claims, quotes, and media to the original context. As we've talked about before, that last part is often increasingly more difficult to do, but that can be, essentially a good thing. Is if we can't find that original, it sort of sets off an alarm bell that maybe impacts how we evaluate how to use that information that we've just engaged with. So a couple of kind of pretty basic but useful educational frameworks that might be something to develop as an intervention. And I shared a couple of examples of these in the resources that were attached to this week's homework. So if you didn't get a chance to look at them, they're on that Padlet too. There's been a lot more sort of game-based interventions in the misinformation space. The two that are on the screen were developed here at the center, and they're both kind of an escape room style game. And if you've not done an escape room, but essentially this is an online version. Obviously, in the real world, when you do an escape room, you're literally locked in a room and you have to do puzzles in order to get yourself out. Online, you're not locked in a room, you're locked in a Zoom room, and you're asked to do puzzles. And our designers at the center have adapted these escape room games to have puzzles that are around sort of core misinformation, so spotting skills. There's one, the Euphorigin, which is the one on the right, that contains a couple of games, for example, about spotting deepfakes. So what's a real image versus an AI generated image. And the one on the left that you see there, the Evergreen Escape Room, was created in collaboration with the Fred Hutch Cancer Center here in Seattle. And that one is based on kind of misleading tactics that are often used to spread nutrition misinformation that is often targeted towards cancer patients. So people learn skills around kind of how emotionally charged information flows, how kind of we might see influencers spreading this kind of information that don't have the credibility to be speaking on the kinds of things that they're speaking about. And game-based play has proven to be like a fairly effective and sort of low intensity way of engaging people in some of this like informational literacy skills learning in a way that's like a little bit less intense than, telling someone they're wrong or fact checking them. It's trying to sort of set a lower stakes environment for people to really engage around misinformation, have a little bit of fun, and hopefully kind of create a space where they're feeling less judged, or at least kind of more open to talking about the kinds of things that they see online. And so usually those kinds of games are paired with a debrief. When we've run them in like library settings where we've had librarians be the host of the game, and then afterwards talk with the people who just played to kind of think about some of the skills that they've learned. On the health side, we often run them with nutrition experts. So afterwards they can think about, oh, I've seen this thing online that this puzzle reminded me of, and talk through that kind of nutrition misinformation that they might have been exposed to. So these game-based interventions can be a kind of more fun way and a less intense way of designing an intervention that, especially in the health space, allows people to open up and think about things that kind of might be seen as more polarizing or harder to talk about. So there's some examples that run the gamut, obviously, from there's educational experiences to how do we directly fact check someone. And so there's a whole sort of range of things that you can think about when you're thinking through intervention design. But before we separate into some small groups and think about what we would want to design, I have some sort of frameworks and guidelines for thinking through how to ask some initial questions to kind of get to what resource creation might be most effective for you or your organization. So when we're thinking about research or design, we think about these questions prior to either designing an intervention or working within a community group to co-design an intervention. So the first thing, obviously, think about what kind of resource, your best resource to undertake, and what is most appropriate to your professional context. And so, as we said, you can go through these really proactive measures, but maybe, it's not appropriate for your organization to create social media content, or you just don't want to be that person in front of a camera doing that. It might be more appropriate for you to create that guide for communicators of how to engage directly with misinformation that you're seeing. It might be that you want to create one of those frameworks for one-on-one conversations, because that's just like how you usually interact with members of the public who might be sharing misinformation. So thinking about kind of what that resource would look like, depending on, what's your comfort or your resources to be able to create it. Secondly, you kind of have to start by clarifying what your key learning objectives are. So what is the point of intervening? We've talked a little bit about this in past weeks. It's not always as simple as like, I'm going to tell this person that the piece of information they shared with me is wrong, and they're going to believe me, and they're going to change their mind. It might be that your primary aim is to increase trust in your organization, so that when you share what you make, your authoritative resources that you share, people will actually use them, which is on the way to getting people to change their mind about misinformation, but it's not necessarily directly fact-checking them. Obviously, you want to consider who your audience is. Some of these interventions, best designed for younger populations, older populations. We think a lot about adapting to kind of language and cultural contexts as well, particularly in the health context. It's really important to kind of figure out kind of how is your community showing up and how might they actually find this useful. And so identifying your audience from the beginning is vital in making sure that you're going to set yourself up for success. And finally, thinking through what the medium constraints are. So how are you going to share this resource that you create? We think a lot about this if we're doing like those game-based interventions. Do we want to do, something that we can do in person and bring people together in a room? Is that not possible with the kind of work that we do? Should we be doing something online or through Zoom? Are we creating a static resource that practitioners can share? And so thinking about how that medium might constrain what it is that you're able to do. So obviously these are a lot of different questions. And so to help kind of think about these, we have this kind of acronym ROAM. So resource, what are you creating? Objective, what's the main point of creating it? Audience, who is it going to be for? And the medium, how will it be presented or shared or disseminated? So to give you a little bit of an example on the screen here, we have been working with some folks over at UW Med to think about vaccine hesitancy, and to particularly think about the tactics that are used to spread vaccine misinformation. So we were asked to design an interactive sort of game that could be both online or adapted to be in person, that really introduces those tactics that people use to spread misinformation. There's things that we see on those misleading headlines that get people, the clickbait that people click on when it comes to vaccine hesitancy. So our resource that needed to be interactive, we decided to produce, a very simple game that could be played in a training session in just a few minutes, or, to help break up the monotony of a Zoom presentation. And so its design was just to stimulate conversation about what people have maybe seen when it comes to these clickbait headlines, and think about how it might contribute to vaccine hesitancy. So our key learning objective was thus to help players to identify some of these misleading narratives and tactics around vaccines that we're commonly seeing on social media, and also kind of create an environment where people felt confident in sharing and discussing vaccines. And so we had these underpinning kind of goals to make opportunities for humor. You'll see the cards on the right there. They were designed to be a kind of Cards Against Humanity, if you've ever played that kind of like very silly, extreme game. And so building in these opportunities for humor so that conversation stayed lighthearted. This is going to be happening in a professional environment. Folks are bringing different opinions to the table, different perspectives. And so we wanted to create this sort of more fun environment for them to be able to talk about things that they might have seen online about vaccines. So our audience in that case was professionals. We were actually working with infection control professionals who work in hospitals, who may have positive views on vaccines, but it's not necessarily a given. But they also might have kind of personal perspectives that kind of intervene or maybe bring a bit of hesitancy to the table. And then finally, thinking through our medium, we originally designed the game to be online. And so we had to kind of make it programmable and clickable so we could share it on Zoom and people could play it. But we also wanted it to be a resource that the people who played it could then go play it with others. So we created sort of a PDF card version that they could print off and play in offline settings as well. And so we're able to make it as like a useful resource in the moment, as well as a resource for the public later on. So that's how we kind of approach this, sort of using that Rome framework, identifying what the resource could be, the main kind of objective, the learning objective, the audience that it's going towards, or maybe could be adapted to a broader audience too, and then the medium of like what our constraints were and how we could create something. And so we're going to break into some small groups and do some sort of thinking through an idea of our own for this. So we'll use those Rome questions, and I'll share them in the chat once people are in the room too, so folks have kind of access to them. But we'll break out into some small groups and have a discussion of like, what is it that we could create? And feel free to be idealistic. Don't necessarily have to think about, oh, we have no budget to do anything, so we can't create anything. Be creative, like what would be useful for your context, and think through that whole gamut. Maybe it's just a motivational interviewing framework that feels like that would be the most useful. Maybe it is social media content. Maybe it is a game-based intervention. So be creative and think through these Rome questions in order to create an intervention. So we'll have probably 10-15 minutes in our small breakout rooms to think through like what could be an exciting intervention we could create, and then we'll come back and share them. And feel free, if you want to kind of write some notes, to use that Padlet link. If you scroll all the way to the far, I can show you actually, far right there, you'll see the group task written here. And you can use the comment section there to write notes if you wish to write them there, or we'll share back in person too.
Thanks, Rachel. I will get these rooms set up. I was just spending some time in some of those things that you all created, like that tool where you click through. I can't remember which one you were just the get bad news.
Oh yeah, that's not that we didn't create that. That's another research team, but that's a that's a well-shared one.
No, but it is interesting to see how misinformation quickly replicates.
Oh yeah, far too quickly.
Very. Okay, I will create. We said we want about 3 people. Okay, so going to put you all into breakout rooms randomly, and we'll do some brainstorming. Open. Okay.
Hi everyone. It's never enough time, but we wanted to check in with everyone before our time ran out. I'll let everyone join first. Great. Well, we didn't actually get to any sort of like designing because I was learning so much from Clancy and Dialda, who I was talking with about things that they've already designed. So feel free also to share about what you've designed. And we also had the like important context that we haven't really engaged enough in is that we're facing like an increasingly tight budgetary environment. We were all talking about the kind of grants that we have lost, and how that's impacted the work that we're able to do in this space, and how the prioritization in that money is also for the next few years going to mean that it's increasingly more difficult to create resources when it comes to addressing misinformation. So that's the big sort of, not even elephant in the room, that is the room that we're in. And so I think a lot of our conversation was also shaped by that. But Clancy or Dielda, would you like to share? We had talked a little bit, I think, about kind of the trusted messengers that you both have been kind of engaged with in previous work. If you could share a little bit more about that, that would be great.
So I work for the Louisiana Office of Public Health within the immunization program. And we did a trusted messenger video series. And then we also did an SME subject matter expert video series where we went into the community and we found someone that was either like a popular IGer, YouTuber, or something that had a network of following. And we got them to do videos around immunization with the correct information. And it was scripted. We gave it to them. Now, the subject matter experts, we kind of let them use their expertise. That wasn't really too scripted. And those were, I mean, fantastic and phenomenal. And I can probably send you some of them, but right at the height when we were getting ready to launch those, the new administration came in and said, oh, take them down, cut it. And, you know, we spent quite a bit of money on those, working with, I think, Covalent Logic from Baton Rouge. And now we can't use them. And then now they've taken all of my 3 grants from me. I came back from vacation to $0.
Yeah.
So
Well, I
think
really hope there's a way that you can use those resources and repurpose them, because there's, I mean, they're so useful for your context, but I'm
yes.
many people on this call would also find them incredibly useful.
Yeah. Dielda, you should, I wrote your name. I'm at this Tulane School of Public Health, so we should certainly chat if there's like a way to like move
Yes.
videos
Yes.
through
You can share
Tulane.
with partners.
Yeah.
Yes. Put your email in the chat for me, please.
Yeah, that's great. And Clancy, do you want to add anything? I know you've been doing that sort of identifying those trusted messengers in the creation of resources too.
Sure. Yeah, so I work for JSI Research and Training Institute. And we, a few years ago, we worked on a childhood vaccination campaign in Santa Clara County, California, which is like South Bay area. And as part of the campaign, which was trying to reach parents and caregivers of primarily children under 5 to like catch up on vaccines, we also developed a training curriculum on addressing vaccine hesitancy and misinformation that was provided to both providers, different types of service providers in the community, and community health workers, based on feedback that we had heard from them just about the conversations and questions that were coming up in their conversations with parents in the community.
And I love that kind of when you create resources, thinking about like what adaptation needs to look like to be able to send them to a different, either, you know, we talked about like, oh, some of them are going out to like professionals who are then chatting with kind of end clients, or some of them are going straight out to the public. And there's not necessarily having to start from the beginning to do that, but there's a translation exercise that you have to obviously engage with. I'd love to throw it out and hear what other people were talking about designing, or maybe lamenting not the ability to not design them in their groups.
I can talk about our group.
Go for it.
I was with Helen and Bedna, and we talked about kind of 2 different things. One was some of us were doing like direct work with individuals. Helen, I'll allow you to talk more about that if you would like to, because it's her thing. Whereas I am kind of a background coordinator person, and I've been, a lot of my conversations recently around misinformation has been specifically around safe infant sleep, and how do you talk to people about what that looks like, and differentiate it between the AAP guidelines, the American Academy of Pediatrics, and what their grandparents did. So I've been talking with some of my partners about potentially creating a motivational interviewing framework for the people who are doing the direct work with individuals to utilize with teenage parents, or potentially pediatricians in their offices. It could be used for a lot of things, but we're really, really early in the stages of that right now and still trying to figure out what that could potentially look like. So this was actually really helpful.
No, that sounds great. As someone who's currently pregnant, my whole social media is now safe sleep practices and people correcting misinformation, but actually spreading more misinformation about what that might look like. And it's such a delicate balance between, because it's such an emotionally charged topic at a time in one's life that is emotionally charged, that it can be really difficult to make sure that you're designing something that like resonates with that person's sort of emotional needs, as well as giving them the best information. So great task to take on.
Yeah. So I'm Helen, and I work for a large hospital, and Bedna and I were both saying how we don't have any control or access or ability to do things like social media, and because it's very tightly controlled where we are. So getting information to people, like for us, it's one-on-one when we're meeting with our patients. Where I'm at, there's like a monthly group that we meet with, that we can do presentations, and I have done presentations on what credible sources mean. Like when I have a patient that comes in and says, I did my own research, like I want to roll my eyes and go, okay, tell me what you found out. And so I've had the opportunity to talk with patients one-on-one or through this group about like finding credible sources. What does that mean? And there are like tutorials you can take, but we were talking about like how gamification of things, like where they can passively like learn through like playing this game, like can you spot the fake photo, or what is real news versus fake news, something that's lighter versus trying to beat them over the head with like how to find like research-based evidence, this and that. So challenges for sure, because we have no access to social media and like a broader like reach, but being able to at least individually meet with people or in small groups is how we tackle it here.
Yeah, we chatted about that, like that it seems the pervasive sort of thing right now is like do your own research, and as we've talked about in the past few weeks, like we do not live in an information environment where it's possible to easily do your own research and access authoritative information. You're instead going to be bombarded by just as much sort of bad stuff as good stuff. So the task is figuring out how do we either change that information environment or give people the better skills to navigate it themselves, if we're going to be really insistent that doing your own research is the way forward. We only have 2 more minutes, so if there's anything else that anyone wants to say, I'm going to just let 1 minute, give 1 minute to that, if anyone else has anything to add from their group.
I just wanted to bring in what Elisa and I talked about. So she works with a lot of pharmacy students, which I thought was like an interesting group. One of the things that kind of came up is like having in the training program some like role playing around patients who might be espousing or having misinformation or disinformation that they're bringing to the pharmacist. Like, what does it look like to have a conversation that goes about dispelling that, providing factual information? And then something, as I was listening to Helen, also like, how do we maybe like use the patients as a conduit to their social networks as well? Like, can I leave you with a palm card that has correct information about childhood vaccinations, right? That you then pass out to your network, right? Has information about the pharmacy, like so on and so forth, so that this becomes a space where students can be that source, but also continues like almost like a multiplier effect in a way. So it's not just the one-on-one interaction.
Yeah, and as we've talked about, like it's the trust that's everything. A lot of what we're talking about is not about correcting misinformation, but building trust in authoritative sources. So leveraging trust when it currently exists in our social networks is a really good way of doing. I'm sharing in the chat as well, actually. If you do work within kind of those professional contexts where you're training with medical professionals, the UW has a really great center that is all about simulation and using role play and simulation in learning. The Wish Institute that has some good resources on activity development that you can do around that. We are at time. Thank you everyone for sharing. I wish that we had even more time because I felt like I learned so much from you all during that last discussion. But hopefully the past 3 weeks have been useful to you. The team will be reaching out with both the recordings and all of the resources that were attached to this in the coming weeks. If you have any questions, feel free to reach out to us. Feel free to reach out to me at the center if you're interested more in kind of health related misinformation and the kind of things that we're seeing across different health contexts. But thank you all for your engagement. It's been really great speaking with you all in the past few weeks, and have a great rest of your day.
Thank you, Rachel. Thanks for coming, everyone. And I dropped the survey in the chat. Please take it. We love to hear what works for y'all.
Thank you.
Thank you.
Right. We'll be in touch with all the resources. It takes us a little bit of time to synthesize it all and put it into documents and clean the videos and all that, but those will be shared and hosted on the Partners for Advancing Health Equity YouTube channel and website, which is a trusted source of research and information on health equity. Thank you for coming.